Teeth are designed to last a lifetime. And in order to ensure that that happens, it is so important that you maintain good oral hygiene throughout your lifetime. Now, I'm going to show you a technique that will help you do a thorough job in cleaning all of your teeth, as well as all the surfaces of the teeth that need to be cleaned. I call the technique roll, wiggle, and whisk. And we're going to go over each motion and how that works. First of all, I want to show you how to get around your mouth completely, making sure that you clean all the surfaces during the time that you brush. Now, here are the teeth that we're going to demonstrate with. I'm going to open this mouth up really wide to show you how first to make sure that you cover all the areas in your mouth. With your brush, let's start in the upper right-hand corner of the mouth. You begin up here, go around the lip side or cheek side of your upper teeth, drop down to the cheek side or lip side of the lower teeth, cross over to the tongue side, work on all of those surfaces, go back up to your upper teeth, to the inside of the upper teeth, and you end up where you started. Now, when you place your toothpaste on your toothbrush, the best place to start and get it moved all around your mouth is by scrubbing the biting surfaces of your upper and lower molar teeth. These surfaces sometimes have food stuck within them, and you can actually use your brush to scrub those surfaces. That's the only place that you want to scrub your teeth. Anywhere else in the mouth where gum tissue is next to your enamel of your teeth, do not scrub. A brush can damage that gum tissue over time. So only scrub the biting surfaces of the teeth and use the technique I'm about to show you to clean all the other surfaces. Now, I'm going to show you how to use the roll, wiggle, and whisk technique. Those are three motions that are important for you to use. Again, it's roll, wiggle, and whisk. And here's how it works. We're going to take a close-up look at the back molar teeth on the upper jaw. Most people, when they take their brush, they scrub the brush back and forth like this. Now, if you notice what the brush is doing, it's cleaning the top surfaces of these molars, but it's missing all of these areas in between the teeth. So what I want you to do instead is use the first motion of the roll, wiggle, whisk technique, which is roll. You take your brush, place it at an angle, and roll the brush. Now look what happens. Do you see how the bristles are getting in between those areas of the teeth? That is very important. They're no longer just limited to the round surfaces of the teeth, they're getting in between the teeth, and that's where the plaque needs to be removed. Now, the second motion in this technique is wiggle. So once you've rolled your brush and you've gotten the bristles in between, now you simply wiggle the brush like this. These are very small back and forth motions. It is not this motion. This is a scrubbing motion, and we don't want you to do that. Instead, place the brush, roll the head to get the bristles in between the teeth, and then wiggle the brush. This causes the bristles to move in between the teeth, loosening the plaque. Now, the way we get the plaque that is loosened now from the teeth, we get it off and away from the teeth, is the final motion, which is whisk. So let's put them together. Roll, wiggle, and whisk. One more time. Roll, wiggle, whisk. Now the way this all goes together, we'll start up with the molar teeth. We roll, wiggle, whisk. Move up a tooth. Roll, wiggle, whisk. Move up a tooth. Roll, wiggle, whisk. Move up a tooth. Roll, wiggle, whisk. And you see, this is how you progressively move around your mouth, getting all those areas clean, not only on the surface, but most importantly, in between the teeth. And this technique also is very gentle on all of the gum tissue. Once you've completed all the surfaces of the teeth, it's best to stick your tongue out and take your brush that still has some toothpaste on it and give your tongue a couple of whisks. This gets the plaque and any food particles that are left over from a meal out from around the taste buds of your tongue. And that's the roll, wiggle, and whisk technique.